being in heart failure is not an easy way to live. It's not an easy way to live as a 40-year-old that looks otherwise healthy and can't do normal activities. It's also mentally not easy to walk around wondering, between today and tomorrow, how much more is the valve going to fail?
We talked for day and night with her. It was really good.
Kristin's heart wouldn't oxygenate her blood. Without surgery, she probably would have died. Instead, she became the youngest child ever to receive open heart surgery here at Children's.
When I was born blue, and my parents didn't really know why or think that there was anything wrong with me.
Christin was born with complex congenital heart disease, something called Tetralogy of Fallot, which is a combination of sort of multiple defects that required surgery to repair and fix those within the first few months of life. As is sort of typical with these patients with this type of heart defect, she ultimately needed a valve replacement.
I grew up going to the cardiologist every year for all of the tests and just the monitoring of my heart and the pulmonary valve to make sure everything was functioning. When I was 29, they recommended that I have an open heart surgery to repair the pulmonary valve. The right side of my heart was double the size that it should be. I remember waking up in recovery, being so hot and completely panicking because I'm intubated and I can't move my arms, I can't talk, and I'm just trapped there. It was probably one of the worst experiences of my life. When I moved to Kansas City, I knew that I needed to establish care at a congenital heart center. Knowing that I am being cared for by a team who really understands the nature of my condition put me at ease. And I knew that when Dr. Migalski was increasing the frequency of my visits, that he was concerned, but that also meant that he was paying attention. So it just reassured me that it wouldn't be a surprise. In October of 2024, I had a cardiac CT scan scheduled for the morning and conveniently had my follow-up scheduled for that afternoon with the cardiology team. And we needed to talk about my valve. The pulmonary valve was deteriorating rapidly, and we do need to replace it.
When it crosses the line of like, okay, we're going to have surgery, especially knowing how traumatic the last one she did that was full open heart was for her. It's like, oh, this is terrifying.
We talked about the possibility of a transcatheter option for her. She, of course, was, very excited about potentially having that as an alternative to a repeat open heart surgery. As soon as I told her, looking at her CAT scan, that I thought she'd be a candidate for that, she really was ready to kind of move full steam ahead and get the procedure done and just try to get herself back to, where she had been and in terms of her ability to do the things she wants to do.
It was astounding how quickly I was back to normal.
Recovery is much easier than open heart surgery. For her, she came in the morning of her procedure. Procedure itself was a couple of hours. And then, she could be up walking around her hospital room later that same day and then went home the next day.
And I'm like, oh, it's already working. Like, I'm already fixed.
Fixing a mechanical problem, either the valve doesn't open well or doesn't seal well, that first option was in 1960. So that science and the surgical development has made huge advances. Transcatheter valve intervention started in 2002, which was a remarkable feat. St. Luke's was the first in the region, one of the 20 medical centers in the country to participate in really landmark, groundbreaking clinical trials to bring this to everyday science and now making it everyday patient care, really the standard of care.
To be able to fix those problems in toddlers and in infants is really amazing. And to get them to adulthood where we then, can take over, takes a special skill set. There are very few cardiologists specifically trained in adult congenital cardiology. And there are very few interventional cardiologists like myself or Dr. Greer who are trained in the type of interventions that adult congenital patients need.
It's been to me the gold standard of, okay, well, what's a hospital when you describe Kansas City? It's like, well, that's St. Luke's. From beginning to end, and everyone that we kind of dealt with, it's tough to describe how reassuring and competent they were.
We have incredible nurses. We have incredible physician assistants and nurse practitioners. And our intensive care program is second to none. The funding makes all the difference in the world because it allows us to now expand what we can do, what we can think of, where we can innovate.
It impacts a person, and you may never meet them, but you do have the opportunity to change someone's life. I know all of the people that donated money to research that got us to the point of being able to replace valves changed my life. And I can only imagine, how science is going to progress in the future.
Catheter-based options to fix and repair heart valve disease has really been transformative in terms of how we can offer better care to patients. We have been really at the forefront, really at the cusp of that science since day one.
We can win in a lot of cases that you can't win somewhere else.
This new valve has given me hope that I can be normal, knowing that I have a consistent care team that knows my history and knows exactly what to look for.
Take a deep breath.
If I could go back and speak to myself when I was in a really dark place, it sounds really trite, but I would say, you're gonna be okay. And this is gonna be a lot easier than you had ever imagined. I feel cared for and supported and seen.
The ability to get back and not be limited in her day-to-day life and improve the quality of life, I think that's a really meaningful thing.